A wound culture and biopsy is a laboratory test used to identify microorganisms causing an infection in an open wound. This test is crucial for determining the type of bacteria or other pathogens present, guiding effective treatment plans. Doctors may order a wound culture when there are signs of infection, such as redness, swelling, or systemic symptoms like fever. This test is often part of a comprehensive health evaluation, including physical exams and other diagnostic tests like blood tests and X-rays. During the procedure, the patient lies on their back with feet raised. The wound is cleaned with an antiseptic solution. A sterile swab or gauze, pre-dipped in antiseptic, is inserted into the wound to collect a sample. This sample is then sent to a lab for analysis. There are 3 main types of wound cultures: swab, stab, and pus cultures. A swab culture involves rubbing a cotton swab in the wound and then on a culture medium. A stab culture uses a sterile needle to obtain a sample. A pus culture involves swabbing pus from the wound. After the sample is sent to the lab, results are usually available within 48 hours. If the results are negative, the dressing should remain on the wound for at least 2 days. Positive results will prompt immediate contact from your healthcare provider. A wound biopsy involves removing a small piece of tissue from the wound to determine the cause and type of infection. This procedure can also diagnose cancerous cells, although it is not commonly performed due to its invasive nature. To prepare for a wound biopsy, clean and sterilize the area, remove any dead tissue, and avoid eating or drinking after midnight on the day of the procedure. Wear loose clothing to your appointment to accommodate any swelling or bruising. A wound culture and biopsy are essential tests for diagnosing and treating wound infections effectively.